So Selinexor has been around for some time. The folks who treat patients with multiple myeloma may be familiar with it, but it also has activity in myelofibrosis. And there's been a phase 1/2 trial looking at Selinexor, mostly in the second-line setting. But there's growing evidence that it is very active in the frontline setting as well, which would make sense. If it works in second line, it should also work in frontline as well. And there are a couple of ongoing trials. There's a large randomized phase 3 trial that's launched looking at Selinexor in the frontline setting. This is going to be a phase 2 trial, a little bit more focused study, looking at a certain subset of patients with blood counts that aren't pristine, if you will. And because we want to get a totality of data here, we want to know how this drug functions in lots of different populations. A lot of the clinical trials that have been done in myelofibrosis pick very select populations, and so the results are not widely applicable. And so if we test the drugs in lots of different populations and get a broader spectrum of who might receive this medication if it were available, it makes a lot more sense. And then we can use that information to apply to everyday practice and things like guidelines. So while this isn't the marquee phase 3 randomized controlled trial, is nonetheless a very important study because it will add to the totality of data as we look at Selinexor as an agent in myelofibrosis.